So when you come to the gym, you're probably thinking about improving athletic performance, toning up, losing weight, and let's be honest, looking good. You're probably not thinking about your heart health or your risk of disease. Your fitness level is actually one of the best predictors for your long-term risk of disease. Research suggests that being unfit is even greater risk to your future health than being a smoker or having diabetes. So what if there's a simple test you could do which can accurately show you a risk of heart disease? We're going to show you just that. The key to this test is how well your heart recovers immediately after exercise. To complete this test, you're going to need three things: a way to monitor your heart rate, a way to measure your rate of perceived exertion, and details of when to stop the test. To measure your heart rate, you can use any heart rate monitoring device, but today we are going to be using the Microsoft Band 2. Now, we won't quite be reaching your maximum heart rate today, but make no mistake, this test is going to be tough. It's meant for people who regularly go to the gym, people who cycle or run, and those who play sport recreationally. If only we had somebody like this who could help us. There are a number of reasons to stop this test, but perhaps the most valuable and easiest method is to calculate your maximum heart rate. If you don't have a wearable piece of technology which can tell you this, you can easily calculate this. All it is 220 minus your age. And it gives us 195 beats. We'll set a warning on Sina's Microsoft Band when she's nearing her maximum heart rate. We're going to be performing this test on a watt bike, so it's one of the most accurate machines we know to perform exercise tests on. In fact, it's good enough for Team GB cycling. If you don't have access to a watt bike, don't worry. You can still do the test, and I'll be showing you how in just a moment. The watt bike has a built-in program called the maximum ramp test, which safely and progressively increases the intensity to get to your maximum heart rate. If you don't have access to a watt bike, you can also do this test on a treadmill, or you simply can go for a run in an outdoor space with a heart rate monitor like the Microsoft Band. You'll need an open space like a park or track where you won't be stopped, and you need to increase the intensity based on your own rate of perceived exertion. Remember, it's far more accurate to complete this test on a watt bike with a heart rate monitor than it is in an uncontrolled environment. Rate of perceived exertion is how hard you feel you're exercising. Up to about level 11 is how you feel when you're sitting to walking. 12 to 16 is how we feel when we're usually exercising. And 18 over 20 should be the hardest you've ever exercised. You should really be in this because you're getting close to your maximum. Selena, how are you feeling? I think that'll about do it. So Selena has worked herself really hard. She's at maximum exertion and near her maximum heart rate. She's also at 18 out of 20 on her rate of perceived exertion. From this moment on, we start timing 1 minute to make sure Selena's heart rate drops at least 18 beats. Your heart rate reducing by 18 beats or more is normal, but if it's less than this, you may be showing some early warning signs of heart disease. Now, there's no need to panic if you get a result like this, but we do recommend you go to your GP or book in for a health assessment. Now, if your heart rate drops by 12 beats or less in the first minute of recovery, we recommend you see your GP more urgently. I've been a physiologist for over 8 years, and in that time I've seen thousands of clients, and I can't stress enough how important fitness is to your long-term health. Studies have shown that fitness is a strong predictor of all-cause mortality. In fact, it's a stronger predictor than traditional risk factors such as high blood pressure and high cholesterol. So you're doing yourself a really big favour by first of all measuring your fitness and continuing to stay fit in the long term.